To me, the most important problem is definition. It's not clear to me whether we should be lumpers or splitters. There's a variety of symptoms, and as mentioned, a variety of mechanisms. Some are not unexpected, like the progression of a bad pneumonia to leave residual pulmonary symptoms. But there is a funny constellation of symptoms which we feel go together with mechanism. And if we do it as one lump sum, we may miss the boat because various disease presentations may respond differently. One of the things that would help would be if there were objective tests for some of these syndromes or constellation of symptoms. For example, the antibody test that was mentioned. People have done muscle biopsies in some of the patients who complain of muscle pain as a major concern, and virus is rarely seen. Inflammatory and immune cells are prominent. So maybe in some cases, a muscle biopsy. The neurologists concentrate on POTS, postural orthostatic tachycardia syndrome, and a number of these patients have symptoms, and when they're put on a tilt table, react as POTS. So I guess I'm trying to avoid putting the person who has a lung that's fibrosed because of a bad pneumonia in someone who's having brain fog, fatigue, and some non or ill-defined symptoms. And how to do that is, I think, for now, based on what few objective tests we have and what we can distill from observational studies. But I think we should be doing studies that kind of separate groups so we can find out if one group responds, maybe the other group doesn't. And if all the groups respond equally, then maybe we will end up with a unitary theory of this syndrome rather than dividing. But I'm more of a cautious splitter, not down to symptoms, because that'll give you 80 groups, but to constellation of symptoms.